just a simple co-funding arrangement, co-investing. It is the fact that, we take a look at the capacity and the excellence of our partners and what they can contribute, what we can contribute, to try to do something bigger, to have a larger impact. And it's not always about money, but the fact that we can make our dollars go further and we can have more impact on patients, families, practitioners. That is why we do research. That is why we fund research.
Partnerships and collaborations are critically important in mental health. When we partner and collaborate together, it usually results in greater efficiency, avoiding duplication, and often opportunities to scale successful programs or initiatives or services are presented as we discover intersections between the work of organizations.
My name is Alexandria Pavlich, and I am a current doctoral student of interdisciplinary studies at the University of Saskatchewan. I was a Mental Health Research Canada and Saskatchewan Health Research Foundation studentship recipient in 2023. My research was focused on how introducing therapy dogs into a local Saskatoon emergency department was able to positively benefit staff as well as patients living with mental health and substance use concerns. But this funding gave me the opportunity to do a community-based research project outside of my dissertation work that I otherwise would not have been able to. It gave me the opportunity to bolster my confidence as a researcher, where I was able to hone my data collection skills as well as project coordination and leadership. But most significant was that it really gave me that opportunity to give back to my own community.
Having SHRF be aligned with a national organization like Mental Health Research Canada, it increases SHRF's reach, but also our reputation of working with like-minded organizations that are high quality with regards to the research that they fund, but they have a good reputation within the community and really they're just quality people as well. So thank you, Akila, for our many years of partnership, and I look forward to many more.
So our project was called See Us, Hear Us COVID-19 Project, Mental Health in Children and Youth in Saskatchewan during COVID-19 pandemic. It was a project that was done in the spring of 2021, at the end of the first year of the school year. And we focus on understanding, unpacking mental health, depression, anxiety, and quality of life, emotional dysregulation, we refer to it, and how children coped, and what their mental health needs were, how they were met, and how we can get this information into people's hands.
We were really wanting to target people who are responsible for making decisions that impact kids' lives. So whether that is a parent or a caregiver, a teacher, people, policymakers in healthcare or in government or in school boards, we wanted to make sure that we were collecting data that would be useful to them to be informing decisions and resources on the kinds of unique supports that kids would need during the pandemic and afterwards.
The help from MHRC and SHRF were really instrumental. Without their help, their funding, this project couldn't have been done. It was not only the funding, but also the support that they gave. They were very interested in learning about what we were finding throughout. Not only at the end of the project when we had the results, but even when we were collecting data, they were interested in knowing how things were coming along. So this was really a good organization to work with. This research really needed to happen when they did happen because without data, without concrete evidence, results, we're just guessing, in terms of what we need to do.
One of the very important gaps that is addressed through our partnership is the authentic engagement of people with lived experience in the research process. This is not happening enough in Canada. It's very important for academic researchers to co-create all the way through the research process from beginning to end with people with lived and living experience. And our partnership with SHRF is focused on that. What is a true highlight about working together with the team at SHRF is that Patrick authentically believes in the power of collaboration. As CEO, he believes in collective impact. And that belief creates a culture across his organization such that all of the team members at SHRF are wonderful to work with and laser focused on ensuring that we work together effectively and efficiently to advance mental health research.